Hello everyone, this is Dr. Sheena Bansal. So today we will talk about intoing. Intoing is the medially deviated foot, as you can see in this picture. So what are the causes of intoing? There is femoral anteversion. In the femoral anteversion, there is problem in the femur. There may be problem in the tibia, that is internal tibial torsion, or there may be problem in the foot itself, that is the metatarsus, adductus, and CTEV. Now, how will you differentiate whether problem is in femur, whether problem is in tibia, whether problem is in foot? Now you can see this picture here. In the first picture, it is shown there is you can see intoing and patella is facing inward. You can see the patella is facing inward. So see here, you can see patella is facing inward, and the second picture patella is not inward, and there is also intoing. It means in the first picture, if patella are facing inward, then there, it means the problem is in the femur. In the second picture, if you can see the patella are not facing inward, it means there is problem in the tibia or there is problem in the foot, but not in the feet. Now, in the second picture, in the next slide, you can see normal foot versus metatarsus CTEV. Now, how will you detect that whether foot is normal or not? Now you can see we will draw a line from the center of the heel. It is pointing towards second or third metatarsal. But in the if there is problem in the foot, that is metatarsus adductus or CTV, it will not line towards the second or third metatarsals, but it will deviate. It is pointing towards fifth metatarsus, that is more laterally. So now you can see it. There is some forefoot adduction that can be seen in the CTV and metatarsus adductus. It means there is problem in the foot. Now, how will you differentiate whether it is metatarsus adductus and whether it is CTV? How can you differentiate? In the CTV, there is equinus deformity, but in the metatarsus adductus, there is no equinus. Now you can see what I said earlier. In the CTV, there is equinus deformity, but in the metatarsus adductus, there is no equinus deformity. Now in this picture you can see W sitting pattern in the femoral anteversion. How does it happen? There is in the femoral anteversion, what happens? Your GT will move posteriorly and your internal rotation will increase. So patient will be more comfortable in with sitting in the W position. Now you can see in this picture, there is normal femur. You can see neck shaft axis in the normal femur and in the anteverted femur. You can see GT goes posteriorly and there is more anteversion angle. Now here the same thing I have shown, GT going posteriorly with more anteversion compensated by intoing. Now this question is for you. What will be the effect on hip biomechanics when GT goes posteriorly? What will the how hip biomechanics will get affected? Now you can see in this picture external tibial torsion trying to compensate for anteversion. If anteversion occurs, external tibial torsion can also occur to compensate for this. How does it happen? Now you can see here patella are facing inward, but sidewise, there you can also see external tibial torsion because there is no intoing. Now patient will have interior knee pain and patellofemoral pain. Now you can see here increased internal rotation. The leg is touching the leg is almost touching the couch. It means it is there is increased internal rotation. How do you calculate the internal rotation? You can calculate it with the vertical axis. Now, but external rotation decreases. Normal internal rotation and external rotation is 60-60. You can learn it by 60-60. Normal internal rotation is 60. Normal external rotation is 60. 60-70. Hip internal and external rotation. I have said earlier the internal rotation get increased in anteversion and external rotation get decreased. Now, if there is no problem in the femur, and you can now you have to rule out whether the problem is in tibia or whether problem is in the foot. I have said you earlier that how will you see if there is abnormality in the foot. You can check it by drawing a line from the center of heel. It should point towards second or third metatarsal. If it is pointing laterally, it means there is forefoot adduction, and you have to rule out now metatarsus adductus and CTEV by seeing equinus deformity. Now what happens? Okay, now you have to rule out whether the problem is in tibia or not. How will you check if there is internal tibial torsion or not? You will make the patient prone, and now you will see the foot thigh angle. Okay, foot thigh angle. Now you can see the foot axis is pointing inwards. It means there is internal tibial torsion. You know, a normal foot progression angle is between the -5 to +15 degree. So plus 10 to 15 degree external tibial torsion is okay. Is foot progression angle is okay. -5 is okay, but not more than -5. If it is more than -5, then you say that patient has intoy. So that was all about intoing. Firstly, now I will recapitulate all the things I have discussed. Firstly, whenever any patient comes to you with the problem of intoing, you have to consider that the problem may be in the femur, the problem may be in the tibia, the problem may be in the foot. To rule out the if there is any femur problem, firstly you will see if patella is facing inward or not. If it is not facing inward, then it means there is no problem in the femur. Then you have to rule out whether the problem is in foot or tibia. Then you will see the thigh foot angle. If it is normal, then it means there is no problem in the tibia. Then you have to rule out with the foot. In the foot, we have two problems, metatarsus adductus and CTV. In the CTV, you also have forefoot adduction and equinus, but in the metatarsus adductus, you don't have equinus deformity. So that was all about the intoy.